Gentlemen, do you remember waking up ready? Firm, strong, alive. That feeling of knowing. Your body was working exactly as it should. But now, nothing. Maybe occasionally, but nothing. Like before. You've been told it's just age, that it happens to everyone, that there's a pill for that. But here's what most men don't realize, that missing morning wood isn't about getting older. It's your body signaling that something critical has been switched off, and you can turn it back on. I'm Dr. Lila Romano, a practicing urologist for over a decade, helping thousands of men over 50 reclaim their vitality without medications. Today, I'm showing you a specific spot that when pressed for less than 60 seconds before bed can restore those strong morning erections you thought were gone forever. Stay with me because by the end, you'll know exactly where this spot is, why it works, and how to use it tonight to start waking up firm and ready again. This isn't about pills or pumps. This is about giving your body the signal it's been waiting for. Before I show you where this spot is, let's understand why you should trust what I'm telling you. In my decade as a urologist specializing in men over 50, I've treated thousands struggling with erectile dysfunction, weak morning erections, and declining sexual confidence. Yes, I prescribe medications when necessary. But what I've learned is many men don't need pharmaceuticals. They just need to understand how their bodies work. This technique is backed by peer-reviewed research. A landmark study in the British Journal of General Practice followed 55 men with a median age of 59 dealing with erectile dysfunction. After 6 months of targeted pelvic floor therapy, 40% regained completely normal function. Another 35% showed significant improvement. No pills, no surgery, just targeted stimulation. Cleveland Clinic and Mayo Clinic have both published research endorsing non-pharmaceutical approaches, including pressure point therapy and pelvic floor activation. The science is clear. When you target the right structures, your body remembers how to respond. I had a 62-year-old patient who'd been without morning erections for over 2 years. His doctor offered Viagra, but he wanted something natural first. I taught him the exact technique I'm sharing with you. Within 3 weeks, his morning would return. Within 6 weeks, it was consistent and strong. He told me, I feel like I got my body back. Traditional medicine doesn't discuss this approach because doctors reach for the prescription. Pad first. It's faster, easier. But the research is clear, targeted pressure point therapy works as well as medication for many men without side effects or cost. The spot I want you to focus on is called the perineum. You might not have heard that term, but once you understand what it is and does, you'll wonder why no one told you about this sooner. The perineum is that soft, springy area between your scrotum and anus. Some call it the taint. In traditional Chinese medicine, it's the gate of life and death because of how central it is to vitality. In Western medicine, we call it the perineal body, one of the most important areas of pelvic anatomy. This isn't just skin. Beneath lies a dense network of structures directly controlling your erections. First, the bulbospongiosus muscle wraps around your penis base and acts like a hydraulic clamp. When aroused, it contracts rhythmically to trap blood inside erectile chambers, keeping you firm. Without proper function, blood flows in but also flows right back out, leaving you soft. Second, branches of the pudendal nerve run through this area. This nerve is the main communication highway between brain and penis, carrying arousal signals that tell your body it's time to get hard. When these pathways are sluggish, the signal weakens and erection weakens with it. Third, perineal arteries directly feed blood into erectile tissue. These small but powerful vessels deliver oxygen-rich blood your penis needs for firmness. When I say the perineum is your erection control center, I mean it literally. This small area is where muscles, nerves, and blood vessels converge to create erections. When you apply targeted pressure here, you activate 3 mechanisms simultaneously. Mechanism 1, you stimulate the bulbospongiosus muscle, waking it up and reminding it how to contract properly. This strengthens your body's ability to lock blood inside the penis. Mechanism 2, You activate pudendal nerve pathways, sending a reflex signal to your spinal cord and brain saying, "We're ready." This primes your nervous system to respond more quickly and powerfully. Mechanism 3. You release pelvic floor tension, allowing blood vessels to open wider and deliver more blood. Like removing a kink from a hose, suddenly, flow is restored. It's like pressing a reset button for your entire pelvic system. One spot, 3 powerful effects. Less than a minute. Okay, let's go deeper into the science so you understand exactly why this is so powerful. The pelvic floor is a group of muscles forming a hammock-like structure at your pelvis base. These muscles support your bladder, bowel, and most importantly, control your erections. The 2 most important muscles are bulbospongiosus and ischiocavernosus. When you get an erection, blood rushes into the corpora cavernosa, 2 spongy chambers running your penis length. But blood flowing in isn't enough. You need to keep it there. That's where these muscles come in. They contract around the penis base and compress veins that would normally drain blood away. It's a natural tourniquet locking blood inside, keeping you hard. But as you age, these muscles weaken. Not just from age, from lack of use. Without regular erections, these muscles aren't exercised. Like any muscle, if you don't use it, it atrophies. It loses tone, strength, and responsiveness. Sitting makes it worse. Chronic stress keeps them in constant low-level contraction, like a fist that never opens. Over time, this tension restricts blood flow. You're in a vicious cycle. Weak muscles can't trap blood effectively, poor blood flow prevents erections, and without erections, muscles get weaker. Pressure point stimulation is a game changer. When you press the perineum, you're sending a direct activation signal to the bulbospongiosus muscle. It's like flipping a switch saying, "Wake up." With consistent stimulation, this muscle regains tone and responsiveness. And when it does, your ability to achieve and maintain firmness improves dramatically. Now comes the part you've been waiting for. I'm walking you through the complete bedtime ritual, step by step, so you know exactly what to do tonight. This takes between 1 and 5 minutes, depending on which technique you choose. I'm giving you 3 options, from beginner to advanced, so you can start at the level that feels right. Step 1. Finding the exact spot. Before pressing, you need to know exactly where it is. Here's how to locate your perineum precisely. Sit comfortably on your bed edge or in a chair with feet flat on the floor. Place fingers at the base of your pelvic muscle, where it connects to your body. Now slowly move your fingers backward, stop halfway. That soft, springy area is your perineum. It feels different from surrounding tissue. It might feel like a small valley or indentation. When you press lightly, it might feel slightly tender. That's normal. It's a sign of built-up tension, exactly what we're releasing. Take a moment right now to locate this spot so you know where it is tonight. Step 2. Post-urination drain release. Here's what most men don't realize. When you finish urinating, there's always a small amount left behind in your urethra. Just a few drops, but those drops sit right next to your prostate all night. That leftover fluid creates low-grade inflammation and keeps the prostate slightly swollen, like pressure building in a valve. Over time, this constant pressure restricts blood flow and makes it harder to get full, firm erections. Here's what to do tonight and every night. After you finish urinating before bed, don't walk away yet. Pause. Place 2 fingers, index and middle, on that perineum spot. Press gently upward toward your bladder for 5 to 7 seconds. You'll probably notice a few extra drops release. That's exactly what we want. That's residual fluid your bladder didn't clear on its own. When you do this, you're not just helping your bladder empty, you're relieving prostate congestion. You're taking pressure off the gland sitting right next to your erectile nerves and blood vessels. This creates better circulation, reduces inflammation, and gives blood a freer pathway to flow into erectile chambers during sleep. Takes 10 seconds, costs nothing, makes a significant difference. Most men feel immediate lightness and relief, like quiet pressure they didn't know there has been released. Step 3. The perineum massage. Now that you've cleared residual fluid and relieved initial pressure, it's time for the main event. I'm giving you 3 techniques. Start with the first, and as you get comfortable over the next few weeks, progress to more advanced versions. Technique 1. The simple press. Sit on your bed edge with feet flat. Place index and middle fingers on the perineum spot. Press straight down with moderate pressure. Firm enough to really feel it, but never painful. If it hurts, you're pressing too hard. Back off. Hold that pressure for 5 to 10 seconds. Release and rest for 3 seconds. Repeat 5 times total. Press for 5 to 10 seconds. Release for 3 seconds. Press again. The entire sequence takes about 1 minute. During those presses, you should feel gentle warmth or a sense of release spreading through your pelvic area. That's blood flow increasing. That's tension melting away. Technique 2, the circular massage. Once you've done the simple press for at least a week and you're comfortable, move to this technique. Same finger placement on the perineum, but instead of pressing and holding, make slow circular motions. Apply slightly more pressure than. The simple press, moving fingers in smooth circles. Do 10 circles moving clockwise, then 10 circles counterclockwise. Keep motion slow and deliberate. You're not rushing, you're massaging deep tissue. This takes about 90 seconds. You're not just activating the spot, you're massaging muscles and fascia beneath the surface. You'll feel pleasant warmth spreading through your pelvis. Many men describe it as a gentle internal massage. That's circulation opening and muscles releasing stored tension. Technique 3, the pulsing activation. Once you've practiced technique 1 or 2 for at least 2 to 3 weeks, move to this advanced option. This is my personal favorite for men ready to take things to the next level. Place fingers on the perineum spot. Instead of holding steady pressure or circling, create a pulsing pattern. Press down firmly for 3 seconds. Release pressure, but don't lift fingers off skin. Just lighten your touch. Hold light contact for 2 seconds. Press down again for 3 seconds. Release to light contact for 2 seconds. Repeat this pulsing pattern 10 to 15 times. The entire sequence takes about 2 minutes. This pulsing creates a pumping effect. You're literally moving blood in and out with each pulse. It's like an internal massage that actively pushes fresh, oxygenated blood into your pelvic floor, prostate, and erectile tissue. Many men tell me this is the technique that finally gave them the breakthrough. Step 4. The nitric oxide breath lock. Here's where the magic really multiplies. While doing any of the 3 massage techniques, add a specific breathing pattern. This is called the nitric oxide breath lock, and it's incredibly powerful. As you're pressing, circling, or pulsing on your perineum, breathe slowly and deeply through your nose. Not your mouth, your nose. Inhale slowly through your nose for 4 counts. Hold gently for 2 counts. Exhale slowly through your nose for 6 counts. Why is this so important? Because your sinus lining naturally produces nitric oxide every time you breathe through your nose. And nitric oxide is the master molecule that relaxes blood vessels and allows blood to flow freely into your penis. So you're combining 2 powerful signals simultaneously. Physical pressure activates muscles and nerves. Nasal breathing floods your system with nitric oxide. It's like turning on 2 switches at once. The effect multiplies exponentially. Do 5 to 10 of these slow breath cycles while performing your perineum technique. Most men immediately feel deeper relaxation, and within a few nights, notice morning erections coming back stronger and more consistently. Now, before you try this tonight, I need to make sure you're doing it safely and effectively. Let me walk you through the 5 biggest mistakes men make and situations where you need to be extra careful. Mistake 1. Pressing too hard. This should never be painful. If you're pressing so hard it hurts, you're overdoing it. Pressure should be firm and deliberate, but comfortable. Think deep tissue massage, not pushing through a wall. If it hurts, back off immediately. Mistake 2. Wrong location. If you press too far back near your anus, you won't hit the right spot. Too far forward under your scrotum, you'll miss it. Take time to locate the exact spot I described, that soft valley halfway between scrotum and anus. Once you find it, you'll know. Mistake 3. Inconsistency. Doing this once or twice won't give results. Your body needs consistent, repeated signals to retrain itself. Think of this like the gym. One workout won't build muscle, but showing up every day for a month will see real changes. Same principle here. Do this every single night before bed. Mistake 4, expecting instant results. This is not Viagra. You won't press the spot and have an erection in an hour. You're rebuilding your body's natural erectile function over weeks. Be patient. Trust the process. Men who see the best results stay consistent and give their bodies time to heal. Mistake 5, skipping the breathing. The nasal breathing component is not optional. It multiplies effectiveness by 2 or 3 times. Always breathe slowly and deeply through your nose while doing the massage. That's how you flood your system with nitric oxide and create the full effect. Now let's talk about who should be careful or check with their doctor first. If you've had recent prostate surgery, wait at least 6 to 8 weeks before trying this and get clearance from your urologist. If you have active hemorrhoids or anal fissures, this technique might irritate them. If you have acute prostatitis, meaning your prostate is actively inflamed and painful, this spot may be too tender right now. And if you have any chronic pelvic pain syndrome, talk to your urologist before trying this. Also, if you try this consistently for 4 to 6 weeks and see no improvement at all, that's a signal to see a doctor. Sudden loss of morning erections can sometimes indicate an underlying vascular or hormonal issue needing medical evaluation. This technique supports healthy function. It doesn't replace medical care. If you experience pain, bleeding, or unusual symptoms, stop immediately and consult your doctor. Now let's talk about what you can realistically expect and when. I want to set honest expectations so you stay motivated and don't get discouraged. Week 1, during the first 7 days, the spot may feel a little tender. That's normal. You're releasing tension stored there for years. Many men notice better sleep quality right away. You'll feel lightness or relief in your pelvic area. You might get one partial morning erection, maybe not fully hard, but something. That's your body starting to respond. Weeks 2 to 3. This is when things get more consistent. You'll likely notice more frequent partial morning erections. Firmness starts increasing. Many men also report better bladder control and fewer nighttime bathroom trips. You might notice spontaneous arousal returning. During the day, little moments where you feel that spark again. That's your nervous system waking back up. Week 4 and beyond. By the end of the first month, about 50% of men experience regular, firmer morning erections. Performance during intimacy improves. Sensitivity increases. And most importantly, you start feeling like yourself again. That confidence, that sense of vitality, it starts coming back. 2 to 3 months. This is when full restoration happens for most men. Your body has fully retrained itself. Morning erections become automatic again, and you've built a habit supporting your sexual health for years to come. Your age plays a role in how quickly you see results. Let me break that down. Ages 50 to 60, you'll likely see faster results. Your tissue is still relatively elastic. Circulation is still pretty good. Many men in this age range start noticing improvements within 2 to 3 weeks. Some even see changes in as little as 10 to 14 days. Ages 60 to 70, it takes a bit more patience. 3 to 4 weeks is more typical before you start seeing consistent results. Your body can absolutely still respond. It just needs a little more time to rebuild those pathways. Age 70 and older, expect the timeline to be closer to 4 to 6 weeks. Results may also be subtler at first, but I promise you, your body can still heal and restore function. I've seen it happen with men in their mid-70s. You just need to stay consistent and trust that your body remembers how to do this. Here's the realistic framing I want you to keep in mind. This is not a pill that works in an hour. This is physical therapy for your erection. It rebuilds your natural function over time. And the men who stay consistent, who do this every single night without fail, those are the men who see the best, most lasting results. Think of it like learning to ride a bike. The first few days feel awkward, but once your body remembers, it becomes automatic. Same thing here. Your body is relearning how to respond. Be patient with it. Give it the time and signal it needs, and you will feel the shift. Here's what I want you to do tonight. After your last bathroom trip before bed, try the simple press technique. Just 10 seconds. That's it. Press that spot, breathe through your nose, and let your body start remembering. Do it every night for 1 week and see what happens. I guarantee you'll feel something shift. Maybe it's better sleep. Maybe it's less pelvic tension. Maybe it's that first partial morning erection you haven't felt in months. Whatever it is, your body is telling you it's responding. And if you have any questions, drop a comment below. I read every single message, and your question might be answered in my next video. This is Dr. Lila Romano, and I'll see you in the next video.